Hey there, if you're a bit overwhelmed about all of this COVID-19 coronavirus mess and you want to do something but you're not sure how to help, you're in the right place. Welcome back. My name is Mandy. I'm the birth nurse, and on this channel, we believe that our bodies are powerful, and with the right support, we are unstoppable. Today is an interview day, and I'm so excited to share with you my friend Shante Perryman, who is a doula, childbirth educator. She's so many things, and she will introduce herself. She is making some big changes for birthing people in COVID-19 right now, and she has some tips on virtual support, which was not what I intended to talk about today, but she's amazing at it. So you're going to hear about that. Parents and doulas and family members need to hear her tips because she's doing it and it's working. And also, she's helping policy in her state from the top down. So we'll explain all of that. You are in the right place. If you're feeling it and you want to make a difference as well, but you're not sure how, give us the likes and share with a pregnant friend. Hey, Shante.
Hi,
Welcome.
Mandy.
Welcome. I'm so glad you're here. Can you please tell everyone that's watching where you're from, like where you're at right now, and what do you do?
Okay. I live in Lexington, Kentucky, and I'm a doula, childbirth educator, evidence-based birth instructor, and spinning babies parent educator.
Awesome. And that's where we got to meet in person.
Yes.
We were in Seattle. Even though I saw you on stage at Evidence-Based Birth, we got to really meet while you were pregnant in Seattle.
Yes.
So I reached out to Shante because she is doing some amazing work, policy work for doulas in Kentucky. And I thought that other people should know what's up and how change is made. What makes a doula essential, you know that word,
Right. Essential.
part of the maternity team?
A doula is essential because, so let me put it like this. This is what I tell my clients when they're trying to hire a doula. And they're like, why do we need a doula?
Right.
And it's like, because your partner isn't trained, and this is not what your partner does on everyday basis. Like they're literally getting thrown into the birth right along with you.
Yeah.
Especially if it's their first baby, like, whoo, it's a complete eye opener. And so a doula is there to help support and encourage and even help like the birthing family advocate for themselves when they don't know how to. So it's like the doula can be like, hey, why don't you ask this? Or what are your thoughts on this? To kind of get those parents thinking and talking to their provider while they're in that birthing situation. And then as you know, Mandy, you know, like when people are in birth and they're like, oh, my back hurts.
Mm-hmm.
It's like, oh, well, partner, why don't you try and give her a massage here, or let's try this double hip squeeze, or try some counter pressure. So, you know, we're essential in that aspect.
Mm-hmm.
Whereas, you know, like the other part of the birthing team, they have other patients or clients that they're caring for. So they can't give you that one-on-one individual attention for hours.
Yes, we would love to,
Right.
but that's not what it's like right now.
No.
Or what it's like in the last decade.
Yeah.
It's not just COVID, but it's probably a little more intense.
Yeah.
With people out on isolation, there's probably less staff than there were, and they don't maintain like an excess of staff. I don't think a lot of businesses do that.
No.
Right. So I love the part about a doula because I teach to build a team that you want with you, whether it's virtual or in person, whether it's early labor or active labor or postpartum. There's all different kinds of teams. Everyone has a different role. Included in a team that can be incredibly powerful is someone that knows birth and trusts birth, the power of birth, the sounds out of birth, the trajectory of birth. They've seen so much that you can just look at someone just like any other experience where you're like, you go to a restaurant with someone who's already been and they bring out flaming plates and you're like, this is a thing? And the person who's been there is like, oh yeah, that's their thing. They do that.
Right.
That's exactly like times 1,000,000 what it's like to have a doula or to have someone that knows birth on your team instead of people that are just close to you. They specifically have that understanding of birth. I find that
Right.
an incredibly powerful aspect of a doula. It's not like a doula is going to tell you how your baby's going to come out.
Right. It's almost like the normalcy of birth.
Right.
Whereas like a partner's like, oh my gosh, should she be sounding like that? Like, is she okay? Like, is something wrong? And it's like, oh yeah, she's good.
Yeah, this
right.
is it. We're
right.
here.
Right. So
there's also been a lot of evidence.
Yes.
Right. There's also like science behind all of this. It's not just bring a friendly face. It is doulas reduce the length of labor.
Yeah.
Reduce the risk for cesarean, reduce the cesarean numbers, reduce the length of pushing, and they increase people's perception of their birth experience. Like hands down, those are without question why I think doulas are essential, but who am I to say that? So how can doulas improve care during COVID-19? What are some specific differences about having a baby now and in the next month or a few months that still make doulas essential? And when I say essential, I mean they can cross the barrier into the hospital and into the birth room, stay there, essentially quarantined with the family. And why are we talking about this now? Because doulas are helpful, and it's, evidence-based practice to have doula support and continuous support in labor. But what's going on right now with doulas, and how are they unique to care in COVID-19?
So COVID-19 is like scary times because you don't know what you're walking into when you enter into the hospital. Like they're even saying like when you push the buttons, like don't push the buttons with your finger. You like get a tissue. Right? But who's thinking about that when you're having a baby and you're like, just get me to the second floor? And so having a doula in that space with you is almost like a reassurance of everything's going to be okay. Let's get to this room. Let's get into this mental space of it's going to be okay. You're going to have your baby and meet your baby soon. And let's not worry about like all the chaos that's going on outside of these four walls.
Yeah,
like you just took like a deep breath. So like, yeah. So let's get some breathing going on and like get this oxytocin flowing and just focus and center in on what's taking place in this moment.
Cool. So it's a big deal when you pass a news crew.
Yeah.
To have someone on your team who is like, we're going to still have a baby. Like it really doesn't matter because the baby train, like labor is headed forward. We're with it. We're fine. We're there.
Yeah.
Okay. So what's going on? What are the rules in your state about doulas?
So right now it's just depends on where you're at. Okay. Here in Lexington, all three hospitals that we have, so last week, one hospital was partner only. And I had a client, so couldn't be there. So I did all virtual stuff. This week, same hospital says, okay, you can have partner and a doula, certified doula. Okay, so all three hospitals now, I know. That's
another talk.
So now this week, all three hospitals are partner and doula.
Okay.
But we know that can literally change next week.
Yeah, by the day.
Right. So some hospitals are still partner doula, and then other hospitals in the state are only partner. So it just depends on what's going on in the area at the time, at the day.
Right.
So to say.
And whenever the wind blows, like who's deciding this? It's just the individual hospitals.
Yeah.
Okay. So what are you doing about that?
So me and two other ladies, we wrote a letter to the governor. He still hasn't responded, by the way, but it's okay.
I was hoping you'd be like,
I know. I did get another contact, so I'm gonna have to reach out to that contact like Monday morning because I try to take a break on the weekends.
Yeah.
So I'm gonna reach out to that contact. And then we also have a letter for the hospitals, the hospital administration. At first, our plan was to send a letter to every hospital administrator saying, hey, can you please make sure in your policy that partner and doula can come into the room, however you want to word that.
Yeah.
But as of right now, it's still that there's partner and doula. So now we're just having our letter on standby for in the event that a hospital decides that they only want just the partner or like no visitors or nobody at all.
Right.
So we're just trying to keep an ear out
and just wait in case that happens, instead of being like, hey, great job, thanks for prioritizing the birthing people's birth. Because if it reduces the length of labor and increases how people feel about their birth experience and increases their ability to make educated decisions, wouldn't everyone want doulas in there because you want to get in and get out? Whether you're sick or you're not sick, like no one wants to spend a lot of time in the hospital unless you're on a ventilator and need oxygen. That's something totally different. Mm-hmm. But my thought process is they should be like, please bring your doula and then get the heck out.
Right. And that's what we wrote in our letter. Like, hey, we know that you're going to be short-staffed and that you have nurses going everywhere. So why not have the doula come in and be with that family and provide that additional support? And we'll call you if we need you. Yeah. We'll call you when it's time for the baby, you know?
Right. Yeah. And the nurse is still going to have the charting and still going to have all of the things, but you know, nothing feels worse than not being able to give exceptional care to someone when they need you. And if they're feeling more alone than usual, they need you. As the nurse, they need us, but that just feels really crappy. I think it's great when patients have doulas and birthing people have doulas, because then I know they're getting really great care, because they've got like 2 birth experts plus the partner that they love or the family member that loves them. So good. So you're writing, or you have letters. Have you heard of times of people that have gotten a hold of governors, and like, what would the governor do?
I think Michigan has succeeded in meeting or getting in touch with their governor, and their governor like being like, yes, let's have doulas in the hospitals. But I think they're the only one.
I think so too, but I didn't know. I think other places are trying, and so the governor can make a
executive order
decision for all the hospitals to follow.
Yeah.
I think it makes it easier for the hospital. Like, it feels like sometimes they're floundering on a lot of this. What's best for everyone? I don't know. You have to just make a decision. But if the governor already makes that decision, like, oh, my hands are tied, I have to. That would be awesome. Okay, so you're trying to get the governor to just, what would be the best answer from the governor?
To let partners, and if the birthing family chooses to have a doula, let the doula be there. Because I mean, now we're running into this situation of like, there's some doulas who don't even want to go into the hospital now because of like everything that's going on. Yeah. And they're willing to just be on standby virtually. Okay. So it's like, I respect both sides of it. Like, if you want to go to the hospital, go. If you want to stay home and support via telehealth, and start calling it, do that too. But as long as that birthing person is supported and getting what they need, I feel like that is what matters for them right now. Okay, so you told us that you did some telehealth or some virtual doula support the other day. How was that? Great. I mean, I was already doing it beforehand, so I know. It's like nothing new to me. You're like, my job. # work. Right. How was it? Were you on a call? So for them, we just use Zoom. Okay. Yeah. I mean, they can call, text, whatever. But we use Zoom for them this time. And her husband, whenever he needed me, he would just send me a Zoom link, and I would click it, and I'd be there. And he'd tell me what was going on. He would ask me, how can I support her better? And I would give him suggestions, and that was it. And he felt pretty confident calling you up anytime, asking you. You had a
face-to-face relationship.
Yes.
Okay. So it was also a unique time. It was a little unexpected.
Yeah.
For that policy to change last minute. Okay. It sounds like that was a unique Zoom experience. I'm doing virtual support today, mostly by text.
Okay.
I think it's probably someone who wouldn't call me unless I think I might just ask her, send her a link and be like, do you want a video chat before bed?
Yeah.
Because what are you not saying?
Yeah. Right. And sometimes you have to be like, okay, so like really what's going on?
Yeah.
Like you
I know
can't
you're nice.
convey that over text, right?
Right. I don't like that. But a call or speakerphone in the bathroom.
Yeah.
You do all that.
Yeah.
Video. Yeah. What's the feedback you get?
They love it.
And they think they feel supported.
Yeah. But the other part of that is that you have to make sure that these families have like a really good understanding of childbirth education before they get into the hospital. Yeah. And that makes your job a whole lot easier.
Got it.
And so you can be like, hey, let's try some whatever technique you want to try. And they're like, yeah, let's try that. And they know how to do it instead of you being like, okay, let's walk through this.
And why?
Yeah.
And they get the why, or they remember there was a why that your brain is working on, and they're just like, yeah, okay, we might be, okay, let's try that. I remember that. Oh, I like that. I think some people are hesitant. I think a lot of people are hesitant about virtual support. And why? I mean, I'm teaching childbirth educators how to go online, and they're like, I can't teach online. I like to use props. I like to be in the classroom. I was like, well, your students are already online learners. Sorry. People having babies have grown up with the internet. And I'm one of the older people, so I can say like, yeah, we had dial-up, but I had lemmings when I was 9 or however old I was. So I know about things on the internet. It's more comfortable than maybe some educators who have taught for a long, long time, but I think families can switch over faster than maybe people who have been doing it a different way.
Yeah. I mean, I still have all my props.
Yeah.
But, you know, I still like show and be like, hey, this is what it is. This is a pelvis.
Right. On my own body, on my props, on images. Everyone learns in a different way. But if you have a relationship beforehand and it's not like a last minute call of like, help me, I'm about to have a baby and the policy just changed. If you have a relationship, do you ever just sit on the phone or sit on a video and just like be there with them?
No.
I
mean, you can.
I was wondering if people like, if they found that helpful.
No, because to me, it's like you're running down your battery for one. And then two, it's like, okay, just call me when you need me. But if they wanted me to, I would. But
I know you would. I know your heart, but your answer, you're like, no, ain't nobody got time for that.
No.
Why would I do that?
No.
And you're just listening to them breathing.
Yeah.
Okay. But having the plan that whoever else is with them, what if they're alone? So pretend
oh my gosh.
Pretend we're in California.
This is the conversation I've been having this week.
Yeah.
That people are having babies by themselves now. And it's like, I don't know how, like my mind hasn't figured out how to process that yet almost. Like, okay.
Yeah.
How can I help someone who's in there by themselves? By themselves. Right.
So yeah, I have been like handling things until I think of that.
Yeah.
I had some people from California and New York in my live class the other day, my childbirth class. It's 3 hours. It's very condensed, but we put a lot of COVID stuff in there, and they were like, give us some partner tips. And I was like, okay, but potentially we want to give you a lot of things that you don't need anyone for in case you're there. So I suggest like having a list of the things that you like of all the 5 senses that we go through, and you go through all of this in your prenatals, write it, because now if you need to remember it, you're not going to remember. And now your nurse can read like literally what you packed. Because if you're like needing your things, you're needing your tools, and you know they're in a bag, but your labor brain doesn't go there. And your nurse isn't just going to go into a bag and be like, is this helpful? Is this helpful?
Right.
What the heck is this? These are pads. Like, that's not helpful. But you have like a labor tools bag. Oh, a tennis ball. Like, she's going to know, or he's going to know.
Right.
They can help you with that, but they're not going to know about it.
No. And so I have another doula friend, because she's the one who brought this up to me, which got my wheels spinning in my head.
Mm.
And I was like, man, I really need to create like some kind of one pager for birthing people and their partners. And because the partner is going to be on the phone.
Right.
Too.
Right. How do you
So
do devices? Like how?
Or you just have to do Zoom where everybody can
Oh,
join in.
Okay. Mm-hmm.
So
And that
that way,
won't be free. That can be free.
it can be free for 40 minutes.
Free. Oh,
Well, no.
I think
not,
3 people is unlimited, is it not?
I don't know.
Okay. So you'd have to look into that, or you'd
Right.
have to continue
Figure something. Yeah.
get new Zoom links every 40
Right.
minutes.
But basically the birthing person I would tell them, these are the things that I have in my doula bag. Maybe you should put some of them in your bag. And I like your idea of have a list of what they have in their bag. Yeah. So partner, you know what's in the bag.
Right.
You can be like, if I'm not on the phone, hey, why don't you get your tennis ball out and go stand against the wall and put it on your lower back? Mm-hmm. So partner is still being involved and giving suggestions.
And play music.
Yeah. Mm-hmm. While birthing person is birthing.
Yeah, you haven't gone to the bathroom. Yeah, you're going to need a list. Yeah. We're writing your list right now. You're going to need, it's going to be 2 pages because it's going to be packing. That's what I have. Yeah. And then things to remember. You probably already have that, but things to be thinking about when you're supporting someone and you're not a doula.
Yeah.
I am glad that you're thinking through all of this with other people too. It sounds overwhelming. It's too much for a pregnant person to really dig into on their own.
It is. Because they're just like, I just want to have my baby in a safe environment.
Yeah.
And
be done. I think a lot of people just want to be on to the other side.
Yeah.
So what can others do to help their own locations, their own cities, their towns, their states, either change policy or improve the support for pregnant people?
If there's a group of people who are already working, like don't try and do this individual. Like create a group. Okay. We have a Kentucky Birth Coalition. So we work together because not one person can do all of this by themselves. I mean, they might be able to, but it's a lot of work. It really is.
Yeah.
So form a group and then divvy up the tasks. Like for us, we had 3 people write the letter. And then we had a standby team of people who were ready to send out the letter. We also were going to send letters to some of the mayors. And so we had another team look up like all the mayors' email and spam mail addresses. So you just have to work together.
Nice. And Michigan, I need to put that link down in this video because I think the letters that the state used in Michigan to get the governor's attention, they are public.
Okay.
I think that's what she said the other day because she said, why write a new one?
Yeah.
So that would be another way to get it done faster. Okay. So form a group and then what you're doing since it's working is consider virtual support.
Mm-hmm.
Cool.
It's okay to go virtual. I think like we were saying, like some people are kind of like hesitant, like, I don't know how that's going to work. And then it's like, once you do it the first time, it's like, I can do this.
Yeah. It's maybe for the support person, for the doula, it's not the same at all. You don't get that. You don't get the hormones that you get, like all of the good feelings that you get in a birth, and it like peaks and peaks and peaks, and the baby comes out, and you get to enjoy that with everyone and take pictures and view someone becoming a parent or becoming a parent again, and that family growing and all the goodness, why we do it. Maybe you're not there at that time. You're not linked in with them. They're on a roll during transition. Sometimes I would imagine you would get a call during transition times. And then
that's normally when they're like, I'm ready to give up.
I'm done. Yeah, I'm done. Come get me. Bring the van.
Yeah.
We're out.
Right.
I need a chicken sandwich. I'm out of here.
Yeah.
And then you talk them through, you remind them of all of their stuff and their affirmations that they love and how powerful they are. And then they get through that hump, and you might not be on the call for the baby.
No. But then you get like all these baby squishy pictures afterwards, and it's like, you did it. You had a baby.
And you knew it was going to happen. And like the doula is like, I knew she was amazing. I knew they were so good together.
Yeah.
Cool. That's awesome. Well, I really appreciate your expertise and your time today. This is exciting. I know people wonder what doulas are, and it gets confusing when you have a nurse and what else do you need? You have a partner, but this is really helpful.
Yeah.
Well, good luck on your journey to discussing with the governor the importance of doulas, because I hope that becomes something that people are listening to in the future without COVID. The power of doula, the evidence behind it. It seems so like duh when everyone hears the evidence, but not everyone, most people don't know what doulas are. Oh, well, thank you so much.
You're welcome.
Tell us where we can find you.
Sure. So you can find me on the internet, like all over the place, really. So my website is Baby Dreams with an S, mc.com, and then it's Baby Dreams NC for Facebook and Instagram also.
Okay, that's easy. mc.com. So we go to your website and we can find all your social media and learn from you and hire you.
Yeah.
Okay, cool.
Because I'm offering virtual doula support.
Yeah. So like all over the world.
Literally.
That's so cool how you can see someone online and then be like, that's my person.
Yeah.
It's hard to find your person sometimes.
It is.
Yeah. I didn't even hire a doula because I don't know any that I could badmouth. Like, really, I have letters of apology after I have babies. I'm like, I seriously hated you. And I'm not going to say sorry about that, but I am sorry I was sarcastic and all the thing. And I'm sorry you like saw all that. I do that. Yeah. It's hard to find your person that you can be yourself and you can like trust what they tell you.
Yeah. And I mean, I tell that to people, like even in consultations, like if I'm not the person for you, that's fine. You're not going to hurt my feelings.
Yeah.
So let me give you some other doulas in the area if they're local.
Yeah.
Who might be a better fit for you. Like, I don't have a problem with that.
No.
Right. It's like, go find somebody who you'll mesh well with.
Yeah. Because if they know you're not going to mesh, like neither of you are going to have a really easy time together.
Yeah. It's going to be kind of awkward.
It's going to be like, what are you not telling me? Like, so yeah, that makes sense. So now people can like see you online and be like, Shante is my person.
I'm it.
That's super exciting. Okay. If you contact Shante and you hire her, you got to tell me. You got to let me know and tag me on Instagram because I'm like, love the matchmaker.
Yeah.
That would be so cool. Okay. Thanks, Shante.
You're welcome.
We'll see you online.
Okay.
Isn't Shante great? She is so amazing for parents and doulas and policymakers in her state of Kentucky. Thank you so much, Shante, for sharing your experience with us and how you are changing the world. Next, check out this video about virtual support in the hospital if your visitor policy has been changed due to the coronavirus, and I'll see you there. She's so simple, as they say in the South. Right. Bless her heart.
Bless your heart.
Love her, but she's lacking in the color department.
Yeah.
Can't even see her. My camera's like, I can't focus. I don't even know what I'm looking at.